Welcome to this case presentation on acute ischemic stroke. Contents: this presentation will cover introduction, learning objectives, SOAP notes, monitoring parameters, interventions, patient counseling, role of pharmacist, and references. Introduction: a stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. A stroke is a medical emergency and prompt treatment is crucial. Three main types of stroke. Ischemic stroke, 87%. Hemorrhagic stroke. Transient ischemic attack, also referred as mini strokes. An ischemic stroke occurs when a vessel supplying blood to the brain is obstructed or narrowed. It accounts for about 87% of all strokes. Epidemiology. Stroke is the third leading cause of death globally and a major cause of physical disability. In India, the prevalence is 1.54 per 1,000 people, and the rate is increasing due to poor lifestyle habits. Etiology: common causes include hypoperfusion from cardiac arrest, embolism due to atrial fibrillation, or arterial plaque. Rare causes include dissection and arteritis. Pathophysiology. An ischemic stroke leads to reduced blood flow, tissue infarction, ATP depletion, and eventually cell death through apoptosis and necrosis, worsened by calcium influx and glutamate release. Signs and symptoms. These include sudden hemiparesis, facial droop, vision changes, speech difficulty, and severe headache. Diagnosis. Diagnosis involves patient history, neurological exams like FAST and NICES, and imaging such as CT or MRI. Treatment. The main treatments include 4-TPA within 4.5 hours and aspirin within 48 hours. Blood pressure control and sometimes surgery like carotid endarterectomy may be required. Detailed treatment is as shown in the chart. In this presentation, these are the learning objectives. Now comes the real case on acute ischemic stroke. Subjective data shows a 66-year-old male was admitted on 21 April 2025 with chief complaints of left-sided weakness since 1 day, more in upper limbs, difficulty in speaking, bladder involvement, and abdominal pain. Social history shows patient was chronic smoker. Power score for all limbs was noted. Objective findings showed elevated levels of BP, RBC, and AST. MRI results confirmed ischemic stroke. As there were right MCA infarct and right ICA occlusion, the assessment confirmed acute plan given to the patient included tablet aspirin plus clopidogrel in the dose of 150 by 75 mg once daily, tab atorvastatin 40 once daily, tablet levetiracetam 500 mg was prescribed twice daily as a prophylaxis for seizure, pantoprazole, multivitamins and ondansetron were also administered intravenously. On day 4 and day 5 of admission, injection enoxaparin and tablet cilnidipine was added respectively. Patient was discharged on day 6. Discharge plan included the following drugs: tab aspirin plus clopidogrel, atorvastatin, levetiracetam, pantoprazole, cilnidipine for 5 days. Monitoring parameters regarding disease included BP levels, blood sugar levels, cholesterol levels, neurological status, FAST, BFAST, MRC muscle power scale, NICES. Drug monitoring includes: for aspirin, monitor bleeding, GI upset; for Clexane, bleeding, thrombocytopenia; for atorvastatin, LFTs and lipid levels; and for cilnidipine, monitor BP regularly. Following were the interventions found in this case: dispensing and administration error. As per physician prescription, patient was prescribed Diplat A, aspirin 150 mg plus clopidogrel 75 mg, but the patient was dispensed with clopicard AP, aspirin 75 mg plus clopidogrel 75 mg, resulting in the administration of reduced dose than the prescribed dose. Secondly, tab cilnidipine 10 mg is prescribed, but as per the American Stroke Association guidelines, the drug is to be prescribed when BP 185 by 110 mmHg, and the usual dose of the drug is 10 mg OD, but at the time of discharge the dose was mentioned as BD. Disease-related counseling, drug-related counseling and lifestyle modifications were given to the patient and his caretaker. These were the role of pharmacists, which were done during the hospitalization duration. And subscribe my channel for more such videos. Thank you.